Hi, this is Dr. Stephen Bradwell, and today what we're going to do is we're going to demonstrate how oxygen and CO2 can be affected by muscle testing. So what we've got over here is we've got Rachel, who's so kindly volunteered, and what we're looking at right here is we're looking at a CO2 or capnography of her breathing, and you can see that she's sitting at 40 millimeters mercury pressure, or we call it PET CO2. That's a measurement of the air that's in the alveoli, which is a pretty good indicator of what her CO2 is in her bloodstream. And CO2 is really important because CO2 helps us keep our acid-base balance. And this becomes important for neurokinetic practitioners because if we muscle test too quickly, we could throw off the CO2, which could also result in altering blood flow to the brain. Because in hypocapnic states or low CO2 states, it can cut blood flow to the brain 40 to 60%. And that's significant, so that could trip a limbic response. And we can see that she's at 41. We want to be between 35 and 45. And the sweet spot pretty much is 38 to 40. So she's really doing well. She's breathing at about 4 breaths per minute. This represents her exhalation, and this is the end tidal, if you will, of her CO2. And then she breathes in and it goes down, etc. Now we're going to look over here. We've got her hooked up with a oxygen sat meter, and you can see that her pulse is at 79 and her O2 sats are at 99, which is perfect. Okay, so we'll look at that and see how that changes as we muscle test her. Now what I'm going to do is I'm going to basically test the core muscles, and I'm going to see, we're going to try to do it just in a way that I would normally do it and see how it affects her CO2. Now we honestly don't know what's going to happen here because we didn't practice this. We don't know. I have my hypothesis, but let's see what happens, okay? Now what we're going to do is I'm going to have you meet my pressure right here. I don't want you just to power me. I want you just to meet my pressure right here, and we're going to go right over here, okay? So take a breath in and just let the air out and meet my pressure right here, okay? And then we're going to come over here, take a breath in, meet my pressure here, okay. We're going to come here, meet my pressure right here to here, breath in, blow it out. And then here, meet my pressure here. And what you can see, I'm going to just stop right now. You can see that she was at normal, and she has started going down below 35. So in this instance, she has, and just breathe, Rachel, just try to breathe normally here. She has already begun to go hypocapnic. Now in that aspect, what we're doing there is we're actually altering her pH of her blood. As soon as she does that, if she stays there very long, her blood is going to go more alkaline because she has dumped out CO2, which is acid. When that happens, the brain does not like alkaline blood. So what it's going to do is it's going to decrease the blood flow probably 40 to 50% right at that point there. Probably 40 to 50%. Now she's come right back up. So that's good. That's good. But if we alter the blood flow, then what happens then as well is, and I don't want to get too technical, but potassium is going to tend to move into the blood cells because potassium is a positive cation. It's alkaline. So the potassium is going to move into the nerve cells, making them a bit more irritable. The importance of this for the NKT practitioner is that we can make somebody go more limbic when they're in a hypocapnic state. If you look up the symptoms of hypocapnia or low CO2 and the symptoms of a limbic response, they're almost identical. Now, whether or not they're the exact same thing or not, I'm not going to comment on. But however, though, if we're in a hypocapnic state, it certainly could give us a limbic response. So let's take a look at what happens if we already see that in pretty gentle muscle testing that it'll begin to change. Let's see if we try to do rapid, how quickly it will change. Okay, so we're just going to go on and check the rest of the muscles. So take a breath in and meet my pressure right here. Okay, now I want you to pull your belly button down to your lumbar spine, and like you're trying to get skinny, okay? You are skinny, but skinnier. And we're gonna do the same thing. Meet my pressure here. Take a breath in, pull the belly button in, meet my pressure. Okay, and I'm still not going really fast, but you can already see that she starts altering her petcos right in those areas there when she was muscle testing. Okay, now let's try doing it rapidly where we go incorrectly. Rachel, I want you to take a deep breath in and blow it out. Meet my pressure. Okay, now what I want you to do is take a deep breath in and blow it out. Meet my pressure. Okay, and we're going to go up in here, take a big breath in, and blow it out, meet my pressure. And she's already failing on her test. Breath in, and blow it out, meet my pressure. Okay, and take a breath in, meet my pressure, and take a breath in, and meet my pressure. Now you can see she's down to about 25, well, she got to 20 there. Some people actually can begin to pass out when you get below 20. The good news is she comes right back. With some patients that have dysfunctional breathing patterns and behavioral breathing problems, they might get trapped in overventilation and not be able to bounce back like Rachel so beautifully does. Well done, well done. But she got down to 25, and you can see when we were testing her, we got her respirations up to 18, and she slowed right back down again. So that's a real good thing that she's doing there. I like that. You might not be so fortunate if you overly or too rapidly test your patient. You actually might trap them in overbreathing because they have dysfunctional breathing habits. So the whole point that I'm trying to make is you need to go slow and gentle and realize that in most cases, in Rachel's case, we did take her hypocapnic when we muscle tested her in a fairly decent way. Now we could try one more thing before we stop. Let's go ahead and I want you to just take a very gentle, I just want you to move air. I don't want you to hold your breath. I want you just to move air. So we'll just have you take a very gentle breath in and then let the air out and meet my pressure. Okay, very well done. Okay, and we're gonna go here, breath in, gentle breath in, let the air out. Just move the air. Don't drop, yeah, there you go, good. A very gentle breath in, meet my pressure. Okay, now a very gentle breath in and meet my pressure. So you can see that what we did was we took a little more gentle approach to it, just very gentle, meet my pressure. I was testing a very low pressure, and you can see that we still pulled her down a bit, which is very interesting to see. But she didn't go hypocapnic, so she didn't get below the 35 mark, which is considered hypocapnic when you get below 35, and then she popped back up. So I think the rule, the thing that we can take away here is that we want to move minimal air. We just want them moving. We want to do minimal pressure, and we want to go maybe a little slower. When we go fast, particularly in the patient that is prone to limbic response, we're going to push them towards that as we make them more hypocapnic. I hope you enjoyed the video. All right, this is Dr. Gradwell. I'm doing a little addendum to the session we did with Rachel before because we didn't cover a couple things that I really wanted to show you. And we were so spontaneous with that because we had never done that before. We didn't want to go and scrap it, but we want to look at a couple things right now. What we see right here is Rachel's just doing beautifully again. This is the CO2 as she's exhausting it. So this is what represents what is in her bloodstream or in her alveolar air. She was talking over here, and she's just beautiful right now at 40, consistently at 40. Sometimes she's going a little bit higher than 40. This is her breathing out. This is her breathing in. And then come back over here. Her oxygen sat rate is at 98%, which is perfect. It's fine. Okay. So what we wanted to show you is what happens when we drop low to that oxygen sat rate. Well, I will tell you it will stay normal. We had an alarm on it, so if it would have gone off, we would have known that she was low, but I didn't show it to you. So I'm going to show it to you so you can see what it looks like, okay? Or believe. All right, so what we're going to do is we're going to do the same thing we did before. We're going to do moderate testing. Take a breath in and meet my pressure right here. All right, take a breath in again and meet my pressure here. And we're going to come over here, take a breath in, meet my pressure. And we're going to go right here, take a breath in, and meet my pressure. And we'll notice that when we did that, she immediately dropped down to about 35, right in here. Her oxygen sat level was at 97%, which is still perfectly normal. And now she's already building up CO2 and coming back up again. But what we see there is when this is happening in this amount, can you see that good? What's happening there is she is actually becoming more alkaline in her blood. That's not really going to create too much of a problem, but if we get her much lower than that, we're going to reduce CO2 or reduce blood flow to the brain by 40 to 60%, probably about 40% here. If we get much lower than that, we're going to push up to 50 and then on to 60%. The point I want you to understand is that if we go down below 40% or decrease 40%, 50%, 60%, how does that affect the brain? Are we going to get access, good access to the motor control systems of the body? And I would tell you that you're not going to. In fact, when we did the testing in the first video, you noticed that I said she's starting to fail. Well, she wasn't getting a good lock on her core because we know we have a core problem here. The purpose of this video isn't to try to diagnose that. The purpose of this video is to do repetitive testing to show you how that affects breathing. But what you notice I said is she's starting to fail more. What was happening is when she was at 25, we're decreasing blood flow to the brain. And when that happens, and I explained a little bit about potassium too, the brain can become more irritable, but we also don't get as much blood flow. When that happens, you're not going to get a good muscle test. So come on over here again. And now we're going to do a little bit more aggressive muscle testing, which is, I believe, is incorrect. You shouldn't do it this fast, but we're going to do it, okay? So take a breath in, big breath in, blow it out, meet my pressure. Now, big breath in, blow it out, meet my pressure. Take a breath in, big breath in, blow it out, meet my pressure. And take a deep breath in, and blow it out, meet my pressure. Okay, and we can see that she's dropped down to 25, actually just a little bit lower, so she's probably at about 22. How did you feel? CO2 sats, look, 99%, 99%. So how'd you feel there, Rachel?
Very dizzy.
She felt very dizzy is what she said, okay? How can a person be very dizzy, have 99% O2 sats, now they're 98, still normal. How can they be dizzy and have normal O2 sats, but have hypocapnia, which is approaching severe, down near 20? She's like at 22. How can that be? What is happening there is she is reducing her blood flow to her brain by 50, perhaps 60%. So technically, she's not getting as much blood flow to the brain, but it's not because she doesn't have enough oxygen. It's because she doesn't have enough CO2. Because she doesn't have enough CO2, her blood's going alkaline. Because her blood's going alkaline, her brain goes, don't bring that crap in here, I don't want it. So it vasoconstricts. The point that we want to understand is that that is going to disrupt a good, accurate muscle test. You're not going to get it because the nervous system isn't at all firing on all cylinders, and you then could also push them into a limbic response. So the thing that we need to learn here, minimal breathing, but move air, and light muscle testing, and go slow so that you're not increasing the depth of the respiration and the rate of the respiration. That's going to create problems, and that's going to give you a bad muscle test and greater probability of creating a limbic response. I hope you enjoyed the video.